Good morning and welcome to StrataSand's webinar, Using Data Visualization to Crush Your Next Meeting. My name is Drake Jarman and I'm joined with Sean Conway.
Hello.
And we are happy to have you here on this, what hopes to be a spring morning in February. As many of you guys know, we are StrataSand. We are based in Nashville, Tennessee. We currently work in 40 states with over 700 hospitals. Our partners range from very large urban systems to rural critical access hospitals and everyone in between. We help those hospitals through very varying ways. On one side, we have an analytics platform. This platform sits on top of state data and Medicare data, as well as demographic data and projections to help your team understand the market analytics of your hospital's service area and beyond. We also have our strategic resource group, which we call Spark Services. That is a team of analysts who can help your strategic growth team with analytics, reports, site selections, environmental assessments, product line deep dives, and the like. The third option that we have is our physician pathway tool. That tool helps our clients understand inbound and outbound referrals, as well as physician splitter volumes and revenue, so that you can uncover strategic growth opportunities. And finally, we have our newest tool, which is called Launch Pathway. And Launch Pathway is something we're going to be showing you guys today. It officially launched into beta mode yesterday, and we're very excited about this tool, and we're excited to show it to you guys today. So before we jump into it, let me say thank you on behalf of the StrataSand team for joining us today. We know you guys are busy, and we appreciate your attendance, and I hope we can teach you some things today. So what we will cover today. The question, how to uncover opportunities and effectively build a compelling presentation for your team. What we want to do today is show you guys different and new ways to uncover opportunities so that you can effectively communicate strategic opportunities and solutions to your executive team to spur strategic growth. Because we know, as strategic planners, it is very important to not only uncover the opportunity, but be able to effectively communicate that opportunity to the senior leadership within your organization so that change and thereby strategic growth may occur. Today, we're going to focus on St. Vincent's Medical Center, which is Riverside, which is in Jacksonville, Florida. It is sunny and warm down there today. I checked the weather, and it's a little chilly here in Nashville, but it's supposed to be 70 later today, which will be wonderful. The topics that we're going to cover today, we're going to go over the data and tools used. We're going to show you guys our newest tool, Launch Pathway. We're also going to show you guys Physician Pathway, and we're going to open it up for questions. Moreover, please note that if you have a question along the way, GoToWebinar has provided a nice little questions opportunity piece here in their platform, and that will send me a question and I may answer it. I may defer to a later time as well, but I hope you guys treat this as a two-way communication. So let's look at the hospital a little bit. It is St. Vincent Medical Center there, Riverside. It is a beautiful 528 bed facility. It is part of Jax Health, which is an Ascension group, and it has two sister facilities in the market as well. They provide most service lines. OB, pulmonary, cardio, gastro, ortho, and general surgery are their top product lines, being there on the west side of Jacksonville. Today, we're going to focus primarily on pulmonary, cardiology, and gastro. And the question that this strategic planner was approached with was, why is our market share waning and what can we do about it? And so really at the end of the day, we want to show you guys how we can uncover quickly and easily why that market share is waning and then provide a solution to do so. So just before we jump into everything, we want to show you guys the service area for this facility, and we're going to show this a bit closer down the line in the presentation. But this is beautiful, sunny Jacksonville, Florida. The blue zip codes are the primary service area for this facility. The facility is this blue dot here in the middle. Once again, we'll show that a little closer as we run through the webinar. But we also have the white facilities are its competing facilities. The blue primary service area was determined based off of 50% of the inpatient origin for the facility, And the green was the fewest number of zip codes to get up to 75% of that inpatient origin. And so you can see a pretty nice size market here, though they do have a large river flowing through the service area, and thus most of their volume does come from the western side of Jacksonville. So let's first jump into the data and tools used. So this will be topic number 1. For today's data, we are going to be talking about AHCA data. This is the Florida Agency for Healthcare Administration. It is going to be very similar to, I see we have some folks from Mississippi, the Mississippi Hospital Association data, THA, THCIC. This is the state data set that each of you should have access to unless you're in Alabama or Arkansas, in which case we could cover this in Medicare. The data tools that we have available in the market to help understand this data would be 1, StrataSand's analytics platform. Obviously, we're biased, and so we listed that one first. But you could accomplish a same or similar task using SPSS, Access, SQL. Also, the advisory board has a tool, Truven, SG2, and there are also a few others in the market that will help you guys uncover these opportunities through the state data sets. Finally, the presentations tools that we will use today. We are once again going to use Launch Pathway. We'll list that first because we are partial and biased, but I hope you guys like it today. We can also use Excel, PowerPoint, and in this case, ArcGIS, or that is our mapping platform, but you can also use Maptitude, MapPoint if you wanted to use that tool as well. There are a few other mapping tools as well. So to uncover this problem, where are our opportunities? Why is our market share waning? The old way to do this, and maybe perhaps some of the way that you guys are currently doing this, would be to receive the raw flat file from the state, and so that would come from AHCA. You would have to format that data, and so that's why we have the hourglass here, because that would take an awful lot of time. To format the data, you're going to crosswalk your common fields, and anybody that has been formatting flat files knows this very, very well. Crosswalking in facility name, payer, patient county, admission type and source, product line definitions, and service area definitions would have to be appended as well. All in all, that is a very, very arduous task, and for a good analyst, it takes weeks at a time to do so on a quarterly basis. You would then want to put a pivot table of that formatted file. From that pivot table, you would want to build a chart to look at your market share, and then you would want to import that into PowerPoint, potentially using a mapping software such as ArcGIS. For those of you guys who are still doing that, I'm sorry. I know that's a tough thing to do. For those of you guys who aren't, if you want to look back into the days of flat file world, we have AHCA's flat file up on the screen. This is the raw data set as it comes out. We also have set up a pivot table as well, and you could pivot this table out until your heart's content, and then start to build that chart, start to build that PowerPoint, and really spend a lot of time uncovering where is that opportunity. Oftentimes spinning your tires, spinning your wheels, trying to really figure out and really stuck on, as we like to call it, the data treadmill. So we want to eliminate that from you guys from having to do that. So as StrataSand grew, that's where we came into creating the analytics platform. And this is, quote, a better way than the previous way. This is where we go ahead and crosswalk all of that data so that it is much more easy. We curate the data, we cleanse the data, and we make sure that it is accurate. Through that process, you would be able and are currently able to run a query on that data, export it into a CSV, pivot, build a chart, and import into PowerPoint. For those of you guys who know our analytics platform, we have that pulled up here. And if I were to look for this type of data in our analytics platform, I would want to start looking at the discharge quarter and year, discharge year, facility name, patient zip code, payer code, and run it as a count. We would go ahead and crosswalk in our product line definitions. We would want to look at the 12 most recent quarters. We'd want to know what the discharge year was the past 3 years, obviously, and so forth. We would create this query, run it, put it into a pivot table, and this is a great option for those of you guys who want to get really deep into the data. And it is the foundational tool on which all things at StrataSand are built. That being said, for those of you guys that want to get an easier way, there is an easier way, and that is what we have just built. as the presentation comes back up. And so that is going to be the best way, what we call StrataSand's launch pathway. And this is going to be a tool that is built on top of Akka as well. And with this, all you have to do is build a launch pad, and you will be able to quickly and easily ascertain where are we doing well, where are we not doing well, where is the volume coming from, and be able to filter that down by product line. Before I jump into that, though, I'm going to start a poll. So I want to know, what tools are you guys currently using? So please feel free to select one or many of these options. And I have launched a poll. And so it is select one or more of the following. Are you guys using a state data provided tool? That would be a Heidi, an Analytics Advantage, Hermes, various tools out there that are provided by the state. Are you using the flat file plus Excel Access SQL or an internal tool? I know we have some folks on from Michigan who have a very nice SQL-based internal tool that they're using to query state data. Or are you using the state data with a vendor tool, not StrataSand? So would that be an advisor board, ST2, TrueVin, IntelliMed, or something else? Are you working with us and using your state data, or are you not currently using state data? So it looks like we have about 57% have voted. Now we're up to 64%, almost quite at a quorum. All right, and now we've passed 68%, and it looks like 71%. Looks like 15% of you guys are using the state-provided tool. About 30% of you guys are using a flat file plus Excel Access SQL or an internal tool. 20% of you guys are using state data plus a vendor tool, and 38% are using state data plus StrataSand, and 14% are not using a tool. So I will close that poll, and thank you for submitting a response. So with that, we are going to jump straight into Launch Pathway. And Launch Pathway is really going to help you guys quickly, easily ascertain what's happening in your market, where are the opportunities, but most importantly, allow you guys to quickly and easily communicate with your executive team on where the opportunities are so that we can create system alignment for strategic growth. Everything we do here at StrataSand is based on strategic growth. All right. So welcome to Launch Pathway. And we are here to create what we call a launch pad. So we will first have to select the data source. For today, as I mentioned, we are going to be using Florida Inpatient. We are going to be using the St. Vincent's service area that I have already built that you guys saw previously. For our service line, we are going to be using StrataSand's inpatient DRG definitions. For those of you guys who work with us, as you know, you are able to upload your own internal both service lines as well as service areas. And so we definitely welcome you to do that. Obviously, our tools do come loaded with that as well. And we'll add our sub-product lines, and we're going to add St. Vincent's in there as well. And we are going to be choosing Riverside. You can see it's two sister facilities. Now we're going to create this launchpad, and bear in mind this is happening in real time as we run through this data. All right, so welcome to Launch Pathway. You guys on this webinar are, all 50 of you guys are amongst the first to see it, so we're happy to have you here. We will touch base on the map here in a second, but it is the same map that you guys saw earlier. Our home facility is here in the middle. That is going to be St. Vincent's Medical Center, Riverside. We have our primary service area in the blue, secondary service area in the green, and we can start to see the other facilities around in the area. As we zoom out, I will locate this Orange Park Medical Center. It's about 8 miles south of our facility, and it is going to be a real competitor for us in our primary service area, primarily in a couple of these zip codes, 32210, as well as 32244, and a couple of others. We'll touch a little bit more on the map elements here in a second, but I want to start with the executive summary. And in this case, we are looking at all product lines. So we've not filtered this to cardiology yet, but this is all product lines. And we're looking at a rolling 36 months. So what we can see here is home facility is actually going to be our St. Vincent's Riverside. We could have selected more than one facility at once, and thus home facility would have been our multiple home facilities. For those of you guys who have multiple facilities in a market, that's what you could do to see how is your system doing against all others. We can see our previous year 1 and 2, as well as our current year. And so this is current through the second quarter of 2016. And we can see overall in this service area that we have built, we are having a bit of a challenge here, some opportunities, as we would like to say. We're losing cases and we are losing market share as well. And so we can see that all others, these are going to be all other hospitals are picking up that market share that we've lost. And it's also important to note that we have an out migration piece here as well, and that is going to be cases of patients who are going to hospitals that are not in this service area that we've built. So out migration, while definitely an issue, is not our biggest issue. It is the 80%, roughly 81% market share that we're losing over here to the other facilities within our service area. Now, some people like to see this as a chart. Some people like to see this as some people like to see this as a table. Some people do like to see this as a chart. And so we do have the option to see how we're doing in a chart as well as a single year chart also. For this executive summary, we do think that the table is the best option. As we go down, and if I didn't mention, we call these pieces over here to the left elements. So our first element is the executive summary. The second element is going to be our facility market share. And so what we're going to see here is St. Vincent's Riverside, the third facility listed there, is third in the market, and that is our facility. And this is ranked as cases, and we've done this as a chart, or we could rate this as a percent as well. But what you can see is 3 years ago, our total cases were 20,570. We were the market leader. We were just barely beating Baptist Medical Center Jacksonville, and they have since overtaken us and are now the current market leader, and we are third in the market. The hospital that we are going to be focusing a lot on is this Orange Park Medical Center, once again, the facility just to the south of us. As you can see, they have had steady consecutive growth over the past 3 years. We're looking at this as cases, but we can also look at this as a percent. And now we can also see our market share as a percent, and you can see we are on a steady downtick as well there. Once again, with this element as well, you could view this as a table or as a single year chart as well to get you guys a better understanding of what's happening in the market. The next thing we want to understand is, and once again, we're looking at all product lines, where is this volume? Where is our market share? So where do the cases exist? And so this first zip code is 32210, and that is going to be our home zip code, or actually just to the south of us. And it is has the most volume in the market. And as you guys can see, and I'll zoom in there, it is on the increase. However, the blue, and let me say this, the elements or the pieces within this bar chart, the orange, green, and teal bars are the total market. These royal blue bars at the bottom are our actual cases. And so what we're seeing is our trend on top of the total market. So we can quickly ascertain that 32210 here is a challenge for us. It's an opportunity. That market is increasing. It looks like our computer audio is having some issues. Thank you, Morgan, for alerting us to that. It looks like it has recovered. But if you guys have trouble hearing me throughout, please let me know. Thanks, Morgan, for that chat. So covering real quick again, in 32210, we're on the downswing, but that market is on the upswing in cases. We can also switch this over to a percent, and we can see really that the overall market share is obviously dwindling in this specific zip code. For a point of reference, 32210 is this zip code over here. Now, beyond geography, we're now going to want to understand the next element, and that is going to be our service line market share. So what service lines are most important to this market, and how are we doing? So we can see that obstetrics is the #1 product in this area. Pulmonary, cardiology, gastro, general medicine, general surgery are the next. And what's really nice about this, the blue bar chart on top of this chart, is it shows that how we are doing compared to the rest of the market. So cardiology overall has increased in cases, and we've remained flat. So if we were only, for those of you guys who are not looking at state data, for the 14% who are not looking at state data from our poll, For those of you guys, you would say, well, our cardiology is staying the same, everything's okay. When in reality, there's been a large increase in cardiology, and we have not captured that cardiology increase. We have been following the market in general surgery, and so we'll take a look at that here in a second to see what that looks like. But you can see, yes, we are doing well in one thing, but we have some opportunities throughout the rest of the service lines. The last piece we're going to look at would be the payer market share. And so what's interesting in this is, as I'm sure a lot of you guys are experiencing, I'm going to switch this over to a percent. We can see that managed Medicare is going to be 12% in the current year, and it's 10% 2 years ago. And so we can switch between the 3 years to see what change is occurring in the payer market share. Medicare for this market overall is actually on a decrease, whereas commercial is increasing slightly. You're getting a lot of Medicaid managed care increase from 11 to 17% in the past 2 years. With all of these elements, as with this one, we can see this as a table as well as a trended chart as well. The trended chart with your payer is going to be nice to see how are we doing with each of the payers over the past 3 years. That's easy to see that Medicare is on the downswing. Our Medicare market share is actually mirroring that. But commercial insurance is on a slight uptick, and we're staying flat there as well. Once again, if you were only looking at your internal data, that would be very, very hard to see. So as we go through, we now see the overall elements that we have available to us on the left to look at all product lines. The next thing I'm going to touch on is going to be the map up here in the top right corner. I zoomed in a little bit for you guys, but we can view the service area, which is what we currently see. The next thing we're going to be able to see is our total market volume. And so this is going to be not just to us, but where is all of the market volume coming from? And so once again, that 32210 is definitely the heaviest zip code in this entire service area. And so that's where the volume is overall. We can see our home market share. So where are we pulling our market share from? We have a nice pull from the west over here. We're doing very well in each of these zip codes. And as I hover over these zip codes, I hope you guys can see that we highlight what the zip code is, and then we also have the market share for that current year in the zip code. And we also have a color gradient scale down here on the bottom left. If we wanted to see that trended, we could also see view previous year 1 and view previous year 2. So we can see how that market share has changed, or if you want to see how the market volume is changing, you can see we're getting a little bit more cases from Middleburg as we go through and as volumes change. The last piece within the mapping is the view the total market trend. So this is going to be a 3-year trend to show overall where are the cases increasing or decreasing. So from up here in Hilliard, Florida, they've lost 94 cases between the current year and the previous year too, whereas 32210 is on a dramatic increase as well. So 32210 is going to be a real opportunity. Now, when we started with these elements, we did notice a few things. We noticed that cardiology, from a service line perspective, was staying flat, yet the market was increasing. And so many of you guys would say, well, great, it's nice to know that, but I want to know more about what's happening in cardiology. Can we filter this data down? And so the absolute answer is yes. We do have the filter section up here. So we have a filter by by product, and I'll zoom out a little bit so you can see that. We have a filter by product lines. We also have a filter by payer. We can filter it by the specific facility, both in the service area or out migration. We have filtered down by zip code. We could filter by the primary service area or the secondary service area, or we could pick the 32210 if that is what we wanted to pick. And then finally, if we could pick age range as well. So if you were looking for a specific age range in cardiology, we would select that as well. So to show you guys how easy it is to say, we've been asked at the beginning, we were asked, why is our market share going down? Well, cardiology is a real reason why our market share is going down, because cases are increasing, but our volume and our cases, our volume and our cases are staying flat. So now we're going to filter this by cardiology, and we're going to have all of those elements for cardiology. So you can see we have filtering slice here. And now we have an executive summary specifically on cardiology. We can see within cardiology that what our current year cases are, and that we've actually increased a little bit, but overall we're not capturing the market share. As I mentioned, We're currently staying flat, but as you guys can see, the overall market is increasing pretty quickly, 13.8% over 2 years, and we're staying relatively flat. We're next going to see the facility market share specifically for cardiology. We come in at number 2 with this product. Once again, we used to be number 1. 3 years ago, we were number 1 for cardiology. UF Health Jacksonville is on the increase, as well as Orange Park Medical Center is on a steady increase here as well. And that's something we're going to want to look at as well. Once again, if you guys wanted to see that as a table, for those of you guys that like tables, that's available, as well as a single year chart as well. We could also start to see where are we losing cardiology market share. And so that is where our friends at 32210 come in. And you can see there's been a dramatic increase in this case. And right now we're at percent. We'll switch over to cases. 32210 has had about 150 cases of increase. And we have actually lost about 30 cases over that 3-year period. And so we have a real opportunity in 32210. Next, we'd want to look at the sub-service lines, and this depends on your product line definitions. But to see, what's happening on the sub-product line level, we do have that available, as well as to see at the payer level, where is that happening? If somebody had a question to say, is this happening in the Medicare space? Well, we could filter by payer and go with managed Medicare as well as with Medicare. And now we've applied that filter to do cardiology with those payers. And now we can see specifically what's happening in Medicare and really drill down quickly into the data to understand where are our opportunities. And you can see there's been a large increase in cases in Medicare, and we've stayed roughly flat. And so, these are real opportunities that we want to be able to show you, to have you guys be able to communicate to your executive team. Now, all this is great in a platform. It's very easy to see this in a platform. But we do know a lot of hospitals that don't necessarily want to share a platform or a login or train multiple users on a platform. And so with that, we would be able to help you guys out there as we've set this up so that in a couple of ways. First of all, let me jump back into that. You can export all of this into a CSV. So if you still harken back to the days of pivot tables and charts in Excel, you're still able to do that by exporting it as a CSV. But a much easier option is to export this as a snapshot. And so with each of our elements, you can see that we have this snapshot feature that is going to export this as a PNG, and you're going to easily be able to import it into a PowerPoint. We can look at geography market share, export as a snapshot. And then also with the maps, we can export those as snapshots as well. So if you want to look at that total market trend and we want to put that into a slide deck, we're going to be able to hit this button here. And then you would want to jump into your PowerPoint. And you can see, I'll delete that guy and I'll bring the old one back. And we can easily drag this into your PowerPoint. And you'll be off to the races so that you can quickly and easily send this to your executive team, put this into your PowerPoint deck, and you've immediately defined the service area, where the market volume is coming from, where the overall lost cases and increased cases are, the total market trend, as well as the home market share. And so you can quickly and easily build a slide deck that you can share with your team. Because as you guys know, it's great that you guys in strategic planning are seeing these trends, but in reality, beyond seeing these trends, you need to be able to effectively communicate both via charts as well as maps so that you guys can communicate the opportunity to the team and really spur strategic growth. Before we jump into the next section, I want to see, let's see, we have another, yes, there was a question, can the filter criteria be exported on the maps and charts? So thank you, Keith, for that question. So yes, if we went back and just did a cardiology filter by payer, and so we'll do that Medicare and managed Medicare again, or actually, let's go commercial on this one. And let's say age range, and we're going to go 50 to 64 for cardiology. Let's only do this in our primary service area. We'll leave all facilities on for now. So now I'm going to apply those filters really quickly. And now the map has changed, as you guys can see very well. I've just turned on the primary service area for our facility. I'm still on the total market trend, but we would be able to quickly and easily export this total market trend in the same manner, so that you would then be able to go into your PowerPoint and go ahead and put that specific map into your PowerPoint. So the filters with the maps do follow. And the next question is the platform live? And yes, so this platform is currently live. It's in beta, so it has not reached, its full, launch date is in April. So it is currently live. And, with that, this is not a prepared, slide deck that we're going through. I'm not on a special website. You can see this is live in our physician pathway, our pathways suite. And so that's a great question as well. Any other questions before we segue a little bit? All right. Yes, if you want to specifically look at competitors' data, can you filter just to view their information to see how they're doing in cardiology and oncology? Yes, that was the last filter that I left off. But right now we have our home facility selected. If we only wanted to see our Orange Park facility there, we would add that filter in. And now we're going to be, and let's go back to our zip codes and let's add the secondary service area in there as well, because that's where they are. And so now we're looking at just Orange Park, and now we can apply those filters. Once again, we're looking at just cardiology as we go through. And I'll close this. And now we're able to see Orange Park. This is Orange Park's cases as we go through. And I filtered it a little, we're a little aggressive on these filters, and so we filtered a lot of the data down as we've gone through. But we're able to filter it by specific facility, yes. We set all of those filters back to the original, and now we're looking at overall. All right, and I think that has answered all of the questions thus far. Medicare. So somebody asked, is this available on Medicare? And that is a hospital that is in Alabama. It will be available for Medicare. It is not going to ship just yet with Medicare, but we are specifically addressing that, specifically for the person, Morgan, who asked the question. So yes, we are building this for Medicare as well. So now that we're able to effectively and quickly build this presentation to start to show that we have an opportunity in cardiology, the question I have for you guys, and we'll launch another poll, is when you guys present an opportunity, and I'm using opportunity for challenge, so to speak, are you guys presenting just the opportunity? Are you saying, hey, we're losing in cardiology in 32210? Or are you guys also presenting the solution? Are you saying, we've done well in general surgery? As you guys saw earlier, this hospital is on the uptick in general surgery. Just so you guys know, this hospital has a great reputation, which is obviously key for general surgery. And they've also added surgeons for general surgery. And they've also aligned their physician liaison team to push general surgery. So general surgery has been a real push for this facility. And so when this strategic planner approaches this problem, we find it best, or when any strategic planner approaches a problem, we do find it best to not just say, hey, we have a problem in cardiology in 32210. We find it best to couple that with a solution. And so I see about a third of you guys have voted. And it looks like about half and half are only showing that there's an opportunity or a challenge, and about the other half are presenting a solution. We do, as I mentioned, find it quite beneficial to pitch a solution, and that's why we're in the Pathways suite here. And so we do have a sister product for this tool to help hospitals find the solution. And in this case, it is going to be Physician Pathway. And so we're going to show you guys how, now that we've uncovered this cardiology opportunity, how can we go to our executive team with a plan of action to really strengthen and improve cardiology. So I'm going to close that poll. It looks like 2/3 of you guys are providing a solution, which is great. I'm going to introduce Sean Conway back into the conversation.
Hey guys, thank you, Drake. So as Drake highlighted earlier, there was several zip codes that we found using Launch Pathway that we had some room for opportunity for, specifically cardiology, and where we were losing some market share by zip code to specifically Orange Park Medical Center. So now, as a solution to that particular opportunity, we're going to use Physician Pathway as a platform to really get into the nitty gritty and find those real opportunities from a physician referral standpoint. So I'm just going to jump right into the tool. And once you get into Physician Pathway, this is the landing page. Over here on the left is where you know the physician you'd like to analyze. This would be their MPI number, a specific name, or a city, or a specific specialty. For today, I'm going to use the zip code function to find physicians where I can really have some opportunities for. And as Drake pointed out earlier, there were several zip codes that we were losing market share for, specifically cardiology. So I'm going to just type in 3 of those zip codes in the Jacksonville Orange Park area. Click next, and I want to look at all internal medicine, family practice, and general practice physicians in those 3 zip codes to find leakage and find some opportunity. So as you can see, using Physician Pathway, over here on our right, we have a dynamic map that shows the office locations of every internal medicine, family practice, and general practice physician in those 3 zip codes located to the south of our main facility, St. Vincent's Medical Center, Riverside. And I want to highlight just 3 physicians for today. And how I'm going to do that, you can actually do that in a variety of different ways. You can choose physicians from a primary hospital affiliation standpoint. This would be where they produce their most revenue. We can choose if you're looking for a specific medical practice, there's an option for that. You can choose a graduation date range from medical school, and this would come into play for a lot of our clients when we're using Physician Pathway for succession planning and figuring out, if they have a particular physician that is on their way out or getting ready to retire. You can be proactive in figuring out the age of a physician in any given market to approach. Or you can just simply type in that particular physician's last name. So I'm going to go down here and I'm going to use the map to find the physicians that I'd really like to look at for today. And as you can see, when you zoom in on the map, the little pins extrapolate to show their actual office locations, by street name and things like that. So I'm going to choose Dr. Tomes. I'm going to choose Dr. Jeffrey Chesler. And I'm going to choose Dr. Thomas Ramey for today. I'm going to analyze these 3 physicians. I'm going to name the report St. Vincent's PCPs. So typically this report takes about 1.5 minutes to 1.45 minutes to run. For the sake of time, because I want you guys to have the opportunity to ask any questions that you'd like, I'm going to pull a little cooking show technique and have this report already run. Excuse me. So here are those 3 physicians that we want to look at for growth opportunities, and the 3 zip codes that we found out using Launch Pathway that we're losing some market share, and specifically to Orange Park Medical Center for cardiology. So a little background into these 3 physicians. Dr. Thomas Ramey is an employed St. Vincent's Medical Center internal medicine doctor. Dr. Chesler is actually an independent internal medicine doctor in that Orange Park zip code. And he is affiliated with not only St. Vincent's Medical Center, but actually Orange Park Medical Center and Baptist Medical Center in Jacksonville. So he's an independent internal medicine doctor that is, as you guys will find out later, is a great physician to have some opportunity and have some conversations with. And Dr. Tomes down here is actually an employed physician for St. Vincent's, along with Dr. Ray. So I'm not going to go through every report on Physician Pathway. I'm going to jump right into the intelligence that we're looking for, what we found from Launch Pathway. So I'm going to jump right into the referrals report. And on this particular report, we actually have inbound and outbound shared patients between physicians in the market. So I'm going to switch it to outbound because I'm trying to find leakage. I'm trying to find some opportunities from a physician referral standpoint to highlight so my physician liaisons can go and talk to these particular physicians. So I'm going to switch it to outbound, and I'm going to click See Details for cardiology. And as I said earlier, I really want to highlight some opportunities from Orange Park Medical Center's perspective. We are losing market share, and they are on the steady incline in our market. So I'm going to filter this report to specifically Orange Park and find some leakage. So as you can see, all three of these physicians are referring out of network to Orange Park Medical Center's cardiologist. And specifically, the highest or the most prevalent opportunity you can see from this report is Dr. Jeffrey Kessler. 134 out of his 214 patients, he is sending out of network, or not out of network, but to Orange Park Medical Center. So as a physician liaison, that is a great opportunity to just have a conversation with Dr. Kessler, figure out what is going on. Is it facilities? Is it scheduling? Whatever the case may be, using Physician Pathway and also using Launch Pathway, you can see the sequence of events to actually find the opportunity and then present your leadership with that solution. We need to go talk to these three physicians. Is that okay? Here's the data. Here are the amount of shared patients between physicians, and let's go make this happen.
That's perfect. That's perfect, Sean. So really, and that's how we want to pair these two platforms together, in that Launch Pathway exposes the opportunities quickly. It eliminates the need to query data. It eliminates the need to mess around with flat files or anything like that, and allows you guys direct visual access to the intelligence within your market. And in doing so, you're able to see immediately where the opportunities are, and you're able to really skip straight to finding a solution, so that when you approach your executive team to create this strategy, you guys have the solution built in. You can effectively communicate it to them so that change can occur from the top down. And so that's really how we are growing as a company to help you guys for strategic growth, providing you with the opportunity to see where you can grow, as well as providing you with the tools to spur on that growth. So that, unless you guys have questions, that is Launch Pathway, as well as Physician Pathway in there as well. I know you guys have been asking questions along the way, but today, obviously, we definitely covered the data and tools used. That's how we uncover the opportunity. Launch Pathway is how we present that opportunity. And then Physician Pathway is how we solve that opportunity. So please feel free to ask more questions. We would love to answer any questions available. As I mentioned, we are currently in beta. If any of you guys are interested in joining us on the beta trial, we would definitely love to have you guys for that, and it will launch effectively in April 1st. So, that is all our time here for today, unless you guys have more questions. Somebody asked for the pricing. That's a great question, and we will be happy to discuss that pricing in a one-off basis. I think for those of you guys who have worked with us, we do have very cost competitive. We're very cost competitive, and we desire that you guys use the tool. Somebody asked if a specific client has purchased this, and I will respond to that person individually. We do have some of our system clients are using this tool. And we're actively seeking additional folks to access the tool as well. But I will respond to that person individually. The next question is, are Launch Pathway and Physician Pathway a package product, or are they separate? And the answer is yes to both. We are selling this as a packaged product, so you can buy the Pathway Suite so that you can uncover the opportunities and solve the problem immediately. Or we are also providing those individually as well. You obviously would get bundle pricing in the process, and we'd love to really be helpful through that. The next question, it is great. That's more like a statement than a question. I appreciate you on that one, Keith. Keep them coming. All right. When will this webinar be available online? It will be available online very shortly, and I believe all attendees will either have access to it, or if you need access to it, please email me. My email is drake@stratasan.com. I can put that up on the screen. Any other questions? All right, with that, I hope you guys have a great day. I hope it warms up wherever you are as well, and we will be outside enjoying the weather and developing some more tools for you guys. So thank you again for joining us today. We really do appreciate it, and I hope you attend our next webinar. I hope you found it helpful. Have a great day.